Thank you for coming in to join us on this lovely evening. I know it's, I think, the second really nice evening we've had in Halifax, so we'll all be out and enjoy that a little later on. My name is Krista Connell, and I have the privilege of being the CEO of the Nova Scotia Health Research Foundation, and we're delighted to be able to share this evening with Dr. Anne Snowdon. Anne is the chair of the World Health Network at the University of Windsor and former chair of the International Center for Health Innovation and Leadership at the Ivy Business School. Now, she asked me not to read any more about her, so because she says it's embarrassing, but I said to her, well, I didn't want anyone to think NSHRF would just bring in anybody. So I'm not going to read any more, so I don't embarrass her, but trust me when I tell you she's not just anybody. So Anne is going to talk to us tonight about what she calls the empowered consumer. And what I want you to pay close attention to is the ability that individuals can have if we're truly empowered to affect change. And we all know that the healthcare system has challenges. We all heard the dire warnings about it becoming 50% or more eventually of the provincial spend, and whether the system is sustainable, and all those kinds of things. So we all know that we do need to have some change. So the conversation tonight is about how we can affect that change and what will help us be in a position to affect that change. So join me in welcoming Anne.
Thank you. Thank you so much, Krista. I am absolutely thrilled to be here. When I was about 1.5, 2 years old, that's where I actually lived in Halifax. I learned to eat lobster here, and I know exactly where to find Peggy's Cove. And every time I come back, I'm absolutely honored to be here. So thank you so much to the Nova Scotia Health Research Foundation. What I'd like to do tonight is share a little bit of the work we're doing at the World Health Innovation Network. But in particular tonight, talk about, so how do we leverage the consumer to help health systems do a much better job to be sustainable, but most importantly, to deliver value to the populations we serve. And the way I'd like to start with that is talk a little bit, so why am I suggesting we need to leverage consumers, and what's going on in the consumer environment? This is a graphic from Tom Goodwin out of the New Yorker. And he says, something really interesting is happening. Uber, largest taxi company in the world that doesn't own a vehicle. Facebook, most powerful, largest social media company in the world, writes no content. Airbnb, largest accommodation provider, and they own absolutely no real estate. So what does that mean? Consumers are going about and influencing and changing and engaging in vastly different models, business models, than they ever have in years ago. Now, some of us in this room grew up pre-internet. Anybody willing to admit that? We are the only population segment in the history of mankind that knows what the world was like without an internet, and now knows what it's like with an internet. So part of our job is to understand what it must be like to only know the world around us without internet, and part of that solution in terms of how do we leverage that for health system change and transformative ways of delivering services by working with consumers, not just the good old days where we know everything there is to know about health. We tell you exactly what to do, when to do it, and how to do it, and we expect everybody just to follow those orders. So really what health systems are now seeing and engaging, and maybe even not sure what to do with, is this new group of people called the empowered consumer. These are not the consumers 10 years ago, for sure, and definitely not 20 years ago. Let's look at a bit of the data around who and what they are and what they spend their time on. Canadians spend 45 hours a month just online. 7 days on Facebook. That's a lot of time. So if they're spending that much time, online and think tools like Facebook, you have to ask the question, it must be achieving something for us because we're all very busy people, we have busy lives, and yet we're carving out a lot of time to use those. Americans, a little more than we do. In the US and in Canada, same story, we all have a smartphone. How many of you, when you forget your smartphone, turn around and go home and get it? Anybody completely, purposely not do that? I'd like to meet you if you, oh really? You and I need to chat. We are so reliant on our smartphone. It is literally embedded into our day-to-day lives. If you think about it, we use our smartphones for our work. People can find me now 24/7. In the good old days, we had the little pink slips. Telephone message, somebody called you, they'd leave it in your mailbox. If you didn't happen to go to your mailbox, no problem. I didn't get your message, right? Those days are gone. Canadians check their smartphones 127 times a day. So again, lots of time using this health system, travel system, banking system, even grocery stores. You can go online, order your groceries, drive up like a drive-through, and they'll put them in their car for you. Our entire lives are actually revolving around and engaging these tools, except in healthcare. I did a study, and Deloitte has done a version of the same. In 2012, just 1 year, there were 44 million unique downloads focused on healthcare. 44 million, that's more people by 10 million than Canadians, our Canadian population. Searching for health information is now the third most popular activity online for all adults over 18. That's actually relatively new. It used to be you'd go online and you'd see Facebook and you'd see silly videos of kids' birthday parties and that. It is now actually a major source of health information. How many times do you think people are actually engaging credible evidence-based sources and sites and providers online? No idea, but it's something to pay attention to. There were, when I last checked, 97,000 apps just focused on healthcare. So about 2 years ago, it was driving me crazy to figure out, I'd never downloaded an app, so I'm one of those pre-internet people that's just getting the hang of this technology. I asked about 6 of my students to go online and tell me the top 100 most often downloaded apps. Android or Apple, paid for, not paid for. I wanted to know, are people paying for these? Are they free? What is it that's driving them? So they did, downloaded those. I went in to figure out what the apps do. I did a qualitative analysis across all these top 100 apps people are downloading, and what do you think the most common paid, unpaid, Android or Apple app actually focused on and did for the people using them? Take a wild guess. Remember, it's a health app. Diet? Close. That was number 3. Sports? Nope. Exercise? That was number 2. Sleep and meditation. Krista, in 5 years, you're the only one that ever answered that correctly. Thank you. So when you think about top 3, sleep and meditation, diet, lifestyle, exercise, very less occasionally things like how to be a good parent for that sector. I missed that part when I had my kids and they were little. It's not disease management. It's not about how do I make sure my A1C sugars are better. It's not how do I protect my joints so I don't have a hip replacement. It's health, wellness, and quality of life. Now think about that relative to health systems. How do we organize a health system? Where do you go in your health system in Halifax to get sleep, meditation, diet, exercise, lifestyle support? There probably are spaces, but generally that is not how our health systems are organized. We're organized in terms of disease management. It's like one of my colleagues says, oh yeah, we're still in the disease and body parts phase of our history and our evolution. This is why we need to be thinking about if consumers are spending that much time and health and wellness is that centrally important to them. They're downloading 97,000 apps in various combinations, permutations. Where and how do healthcare systems now start to engage these consumers to support them and to work with them to achieve their goals, keeping people healthier, which by definition should be, if you achieve health goals like diet, exercise, sleep, meditation, we should see pretty interesting changes in things like chronic illness, maybe mental health. Those studies are yet to happen. But I don't think that health systems, I haven't seen many, that are thinking along the lines of transforming how we deliver services that mobilize that very large consumer activity. Now, a lot of people say, well, Anne, most of the patients in our health systems, they're older. Seniors don't use smartphones and tablets. Wrong. They are the fastest growing market segment now, purchasing smartphones, tablets. Why? That's where you find your grandchildren. If you are a senior with grandchildren, of course, it makes sense. All of the babies' pictures, Ian just started walking, that shows up on Facebook. We don't do the telephone thing so much anymore, and in fact, many people don't have a landline, they just use cell phones. The other interesting thing about this is this mobile healthcare market. How big is this market? Its global revenues have increased 360%. Where and what other sector have you seen from the economic view of the world that's rapidly increasing that quickly? By 2017, they're estimating $26 billion in revenue just on the mobile digital app market. So it's a wildly impressive sector that, again, another reason we should probably be thinking about how we engage it, because the growth is that rapid over a very short time. When you really ask yourself the question, why is it and how is it, what's the outcomes of our consumers being so heavily engaged online? I heard a funny story from our university president who shared with me, I don't know if you know this, do you know what the attention span of a goldfish is? You're a fishing part of the country. I'm not so much. We're landlocked. But the attention span of a goldfish is 9 seconds. I thought that was pretty long. Do you know what the attention span of Canadian youth are? 8 seconds. Used to be 12. So they're actually seeing pretty significant impact just from having what? Information that's very transparent and very much real time. We are so conditioned to watching things as they're unfolding now on our tablets and our smartphones. Think of the Orlando tragedy. That particular individual was calling and on Facebook to tell the world about what was unfolding, which you can argue is not something we should be celebrating at all, but it's this real-time transparency that our consumer public has really grown accustomed to. Now think again about health services. Where and how have we progressed in terms of transparency and real-time information? Not so much. When you get lab results, you tend to have to make a follow-up appointment with your GP, wait for a week, 10 days, whatever it is, to get the lab results, where, in fact, the largest lab group in the country can produce it for you instantly if the system enabled us to do that, because they transmit it digitally in terms of how they get information to doctors. So essentially, with the use of these digital mobile apps and download tools and all this work on Facebook and reason they go to the internet for health information, consumers are creating their own health system. They have their app for their diet and exercise. They have their app for their sleep and wellness. They have platforms now where you can engage and increasingly self-monitor and self-manage a lot of your health challenges. The million-dollar catch issue is it's not connected to our formalized health system. And we all know, and let me declare my bias, I'm married to a plastic surgeon. And now, with the internet, and he has his consults coming into the office, they come in with 6 pages of Google questions to ask your physician. So it's a lot about coaching and making sure information's credible and information-based, and it's completely shifting the dynamic in terms of health providers are actually working with their patients. Our big challenge, really, in health systems, we talk about, yes, how expensive healthcare is, how much demand there is, but it's expensive and there's a ton of demand because everything we're doing is manual and paper-based and in-person only. Now, does that mean we throw out the whole in-person thing? Not at all. But there are segments of our population, and I'll talk about a few of them in a moment, that could really benefit, but much more automated and connectivity using digital tools to streamline this flow of information so that we've actually got information at our fingertips like we do in every other sector to make good decisions. The other shift in consumers is the generational shift. And in families, my mother always used to say, well, it sure wasn't like that when I went to high school. I don't know what's happening to the world around me. And you've all nodding, I'm sure you had the same experience I did. But think about what this new generation is going to present to in terms of health systems and how that changes our transactions and our interactions in this sector. So my parents. When my parents needed to go to a physician or nurse practitioner clinic, whoever it was, they were quite accepting of the wait. You call on a landline telephone. You get a lovely receptionist named Jean. And Jean says, oh, I can slip you in on Tuesday afternoon at 4. That's the way it worked. That's the way it always worked. And it was pretty much accepted. They really valued their stable relationships. They would pick the surgeon, the specialist, the provider because, well, I went to school with her sister. They were great. They are very loyal to brand. That was the family. You grew up as a Ford family, maybe a GM family. I live in Windsor, of course. That's the automotive Disneyland of the country. So you were either on the Ford plant, the GM, the Chrysler, and never the three shall talk to each other. But brand loyalty is very important. Health is seen as a service, and the most interesting part of this is they defer to the expertise of the provider. So when I would go with my mom, who has Alzheimer's and had her very early consults and assessments, I would ask lots of questions, of course, like most nurses might. And she'd turn around and said, Anne, stop asking so many questions. You might upset him. It's like, Mom, upsetting him is the last thing I'm worried about. But that was her generation. What's the new generation like? Quite different. They are not patient. Think about real-time information and things unfolding on a smartphone as they're unfolding. They are not waiting around. When they get that appointment that's, next Tuesday or 2 weeks from now, I'm not doing that. I'll go online and see what my other options are. They will research it very heavily. They have no loyalty to brand. They don't care whether that car is Chrysler, Ford, or GM. They are very loyal to value. And it's value according to how they define it, not how it's defined for them. They see health as a right. They get quite unhappy if they don't get the health they want when they want it. And they are not going in to defer to provider expertise. They go in researching heavily. They take those Google questions with them. They ask for data. They want to know what clinical trials this opinion is based on. And then they negotiate with providers in terms of, well, maybe I'll consider having you as my physician, nurse practitioner, whoever. So it's a very different generational shift. And recall that most health providers today were educated quite nicely to be that expert. Clinical pathways, evidence-based. Oh, no, if it's not evidence, that's not a good idea. And we're even socialized to have these conversations with our patients and families as to why they should do what you're suggesting they should do it, right? It's completely reversing now, and this is not a group that we've actually been socialized. Business schools teach you how to negotiate. Nursing schools, schools of social work, medical schools, not so much. So it's actually a whole different skill set and competency that we now need for this upcoming generation. Here's a couple of other interesting population segments to pay attention to. Women are a very centrally important group. Women, 94% of the time, are the chief medical officer for the family. They are making the health decisions for their children, and we're making health decisions for our aging parents. With our demographics today in Canada, we are now providing care for aging parents more years than we have children at home. Most women are working. So think about that working mom. She's got kids at home with things going on and hoping to make sure they're healthy and they're not doing crazy things in their car or anything else. And they've got aging parents that they don't want to fall or break a hip, or I wonder if they've eaten, and all those good things. It's a tough time to be a working mom and managing those family health behaviors. So when you walk into Emerge as one of these women, my son had a spontaneous pneumothorax about 2 years ago. Walked into Emerge with him, and one of the first questions is, well, when's the last time he had a tetanus shot? He's 24. I have absolutely no idea. I said, gee, I have no idea. And they looked at me really odd, and they said, well, don't you have that little yellow card? I said, wait a second, you mean the one that I had to bring to grade 1 in order to get the public health nurse's signature so he could stay in school? Yeah, that's the one. I said, he's 24. Think about that for just a moment. Imagine the automatic upload of all your vaccination history and your kids and your aging parents on your smartphone, so when you ask that question, you could actually give them an intelligent answer. Same thing with my parents. You walk into Emerge, and they want to know what medications they are on. How many of us have that updated list of medications from the pharmacy? Even as a power of attorney, I have no idea what medication she's on. So that Emerge team has to figure that out painstakingly with me, with my little bag of pills, going through one by one, when's the last time they were ordered and renewed and all those good things. These are the simple things that health systems could be thinking about to make not only that visit to emerge or hospitalization or family health team or primary care clinic or whatever so much more streamlined, but also more importantly really well informed by those caregivers and patients. So the conversation starts with, oh, I see you're on these 24 meds. How are they working for you? Rather than spending the first hour going through painstaking 1 hour at a time. The other group of consumers that's very interesting and why lots of speculation on are what's affectionately known as the baby boomers. Baby boomers today have 47 times greater net worth than adults 30 to 45 years old. They account for more than half of all retail spending in North America. They have very distinct and unique values embedded in this group. Now remember, this is the population segment that has transformed social systems for decades. One of their central values is agelessness. They don't believe they age and they don't plan to age. It is not shocking that Botox and Botox clinics are wildly popular. 15, 20 years ago, Botox wasn't used for people's faces and wrinkles and making them look 10 years younger, but that's very much driven by this market. This is a group that don't plan to age anytime soon. It's Harley Davidson has their whole business model wrapped around the boomers. They can afford to buy Harley Davidsons. They want to ride Harley Davidsons, and when you watch them go by, most of them are baby boomers. They're not the 22-year-olds that we used to see in the movies. Autonomy. This is a population sector that absolutely values autonomy. They will make their decision and nobody's going to be telling them what their decision is going to be. Think about what that means for long-term care, residential support when they're staying in their communities and they're 85 or 90 and counting. And the third one's personalization. One of my colleagues always says, you know, boomers, their theme song, My Way. It's about me. I don't care about anyone else. I could care less about clinical pathways or what the best advice is. Here's what I need. Here's where I'm going. You come with me or you don't. And quite frankly, if you don't, I'll find someone who will. This is not a group that we've really seen quite yet. They're also very healthy because they have access to resources, of course. But this will be a very interesting group in terms of how it transforms care well into senior years. So chronic illness rates are increasing rapidly. Have a look at hypertension. Hypertension is a very significant challenge. Think about those mothers managing high blood pressure in their parents and trying to keep their kids healthy well into adulthood so they don't have the high rates of obesity that are going to drive hypertension. 42% of our Alzheimer's dementia cases are related to cardiovascular changes or vascular changes in the brain. If you aggressively manage hypertension, you're actually offsetting either the severity or the onset of very challenging issues like Alzheimer's, among many others. So chronic illness rates are going to increase, and they're going to drive more demands on our healthcare system. The only million-dollar question is, how do we mobilize and support and wrap care around these decision makers in families like women to offset and try to plateau some of those rates of chronic illness, because it will be an incredible challenge. The future of healthcare, no question, is figuring out better ways to achieve value for consumers by engaging them more directly and embedding our health system service delivery models, at least to some degree, into our day-to-day lives. So that means digital technologies we use to shop and study and do our banking and travel need to add healthcare to that list in a very significant way. The million-dollar question is exactly how do we do that? A colleague of mine had a pacemaker put in about a year ago. Had usual problems, pacemaker fixed it perfectly, she was great. She was sitting in a meeting a year later, and she got all pale and sweaty and didn't look well at all, thought she should call 911, but it went away. Went to her cardiology team, took her about 2 weeks to get an appointment, and she said, look, I had this lightning bolt through my chest about 2 weeks ago, like, what do you think happened? And he said, oh, don't worry about that, we were just testing the batteries. It's like, wait a second. They were 10-hour drive away from her. They have the Bluetooth capability to test the batteries on the pacemaker. So we have the technology in these digital tools The only $1 million question is, yeah, the provider needed to make sure the batteries are working, but these families and patients with pacemakers needed to have a much, much better sense of connectivity in a much smarter model. Here's one of the key populations we're spending some time on because, at least in my opinion, based on some of the data I've seen, this is a group, if you're going to start to design ways to reach out to population segments using digital technology, it's probably this one. So 50% of adult mental health actually starts before the age of 14. This quote came from Kimberly Moran, you might remember from The Current, that CBC radio show or television show, who talks about we experience wait times for almost a year, and in some cases over a year. Within a few months, their daughter had attempted suicide. That for me is not an outcome I'm willing to accept, I guess. Not as a parent in Canada, very wealthy, very informed, and very educated country, and one that we haven't really even thought of reaching out to youth using these mobile digital tools on smartphones. How are you feeling? Here's a number you can get help, or connecting them to some kind of a healthcare team so that when and where and how they need support, they actually get it. And if you start to engage youth online digitally, even if you're just raising awareness, so the person who saw it online is where to help goes to the roommate next door to support them to get help, I think we would be way down the road. We're working with 4 different provinces in the country right now on how do we design integrated youth mental health models where no matter where you go, what door opens, it's the right door, you get the help you need when and how you need it. But the digital strategy is nowhere. None of the provinces have even thought about, well, yeah, it's a good idea, where do we start? But I think it's a very important one for us to be thinking about. Smart Mental Health, Rama is a very talented young researcher that's working with us. We were talking about this the other day, analyzing some data, and she said, you know, the idea that I can have my individualized mental health care and healthcare team in my pocket, walking with me where I go, at my fingertips, is exactly what we need to get to. So one of the key areas in youth mental health is youth-designed, youth-centric. I had an email from an organization who was very thrilled that they had created this beautiful mobile bus that would drive around to communities with a youth mental health team, and it was all painted. Kind of reminded me of the Partridge Family of the 60s. There's only a few of you that would actually know who that is. And I sent it to some of the youth advocates I was working with. I said, what do you think about this whole mobile idea with the bus? She says, well, Anne, if that's all there is, but please look at the paint job on that bus. So I think we really have to think about who should be designing it. It shouldn't be me, because look, I'm still trying to figure out Twitter. It should be youth. We need to be co-creating these technologies with them, and that's when they feel as though someone's walking with them, and they know they can connect where and how they need to get the help they need. We are actually, what we're really talking about, I think, in health system innovation and transformation is about redefining healthcare and shifting towards patient and family goals. How is it that we as providers, teams, organizations, hospitals, help them get to their goals that they want to meet, and the flexibility to determine what's important to them as opposed to what I think should be important to them. That is not a small shift for clinical teams and health organizations to start to make. So let me introduce an example of what I mean by that. This is just a stock photo, but let me present a real case of Jim, also not his name. Jim is just over 70 years old, looks not unlike this gentleman, has COPD. He takes about 24 different medications. He has been in hospital a whole bunch of times, 8 admissions in 14 weeks, multiple ED visits. His wife is shaking like a leaf every time they show up. And this project really looks at how do we wrap integrated care around these people that we would call the higher user or complex patient. The case manager sat down with Jim very first time we met him and said, Jim, if there was 1 or 2 things I could make happen for you that would be helpful, what would it be? What do you think he told her? Number 1, can you get my wife to stop yelling at me? And she thought, okay, canary in the tunnel, right? When wife is yelling at me, there's a lot of stress at home. We do need to figure that out. Number 2, can you get these people out of my house? And she said to him, what do you mean? What people in your house? She's actually on the track of, okay, maybe there's some delusions here, something going on. Oh no, I have 8 different nurses and I don't even know who they are, but they come and visit. Sure enough, she looked up the community nurse visiting program that was working with him. 8 different service providers were going into his home every week. It was like, Christmas Eve at Macy's, the revolving door of providers. Yet he was in Emerge that often with 8 providers going into his home every week. Clearly we're missing the boat. So what they did was, and the reason he was going into Emerge so many times was because his medications, he was either not taking them or taking too many, which was why the wife was so stressed out, because she was trying to help with the medications. 24 meds, many times, 1 a day, twice a day, 4 times a day. She had no chance of tracking this. So we had 2 really incredible interventions. We bought a fishing tackle box for Jim at Walmart and labeled each of his meds on, the little lure things at the top, Monday morning meds, Monday afternoon meds. The wife was thrilled. She had her fishing tackle box. She took the whole box to the pharmacist to renew them. The pharmacist made sure all the right ones were in the right compartments. This is where innovation is not high tech. This is just helping people have the tools they need to actually manage their own care. Within 10 days of just organizing medications, Jim said to the case manager, I haven't felt this good in 30 years. In 6 months, he did not need to go back to Emerge or didn't have a hospital visit. So we went from 8 visitors going in every week and multiple Emerge admissions and hospitalizations to not very much, simply by organizing their meds. And the other thing we did was put a paramedic visitor in that got to know Jim and dropped in. He said, Jim, I'm coming by. I have a call down the road. Do you need any groceries? And it was a happy ending. So that's the tailored, personalized models of care. They are not our clinical pathways. And I'm not suggesting clinical pathways don't matter. They do. But they are simply the starting platform that you start with. For guys like Jim, there's no clinical pathway for somebody with 4 or 5 chronic illnesses. In this population, we're following about 200 people right now. Over 50% of them have mental health challenges and 3 to 5 other issues they're trying to deal with. The majority live at or below the poverty line, and many of them may or may not have any caregiver support around them. So this is the personalization, sort of consumer support. We have looked with this group at giving them and working with digital tools. Our challenge is many of them don't have any internet access. Because if you don't subscribe to an internet provider, then how do you engage with these people? So that is a challenge we have to overcome and figure out, and that is a whole policy framework around assisted devices. You can't buy a computer for these patients, but I could buy a wheelchair for him. Well, he doesn't need a wheelchair, but he does need a computer or a tablet. So I think that's a policy issue we're facing. We did a different study with patients with chronic renal disease, and I mapped all the different pathways of information the caregivers were having to manage for these particular people with chronic renal disease. And this is actually a fairly clear picture of some of the mapping. It just speaks to some of the complexity of what we put people through in trying to find the different clinical services they need, in addition to the care they get from their families and their peers and everybody else. Essentially, we need to not only achieve this transparency of information I talked about a few minutes ago, but I think we have to really rethink how our clinical teams are working together. Instead of sending someone to 7 different places to get 7 different types of health, or sending 8 different people in to people like Jim, this is more the Formula One team strategy. When a car pulls over in Formula One, everybody has a job to do and everyone knows exactly what that job is and how it relates to all the other jobs. And guess what? They share information and they measure how effective they are. That is a little bit of an overstatement in terms of how primary care or how teams could work in communities, but it's not far off in terms of what kinds of roles we should be playing and how those roles need to be knit together to complete that very, very integrated package for patients. So it's no longer really for health systems the one-size-fits-all clinical pathway, best evidence, everybody gets the same. It's taking that evidence we have and molding it and shaping it and making sure it works for the family and the patient, and it gives them the connectivity to the help they actually need. What that also does is shift your accountability. It's no longer provider in charge, patient and family just follow the orders. It's a shared accountability, and many providers will tell you, and it's all sounds fine and dandy, but when I absolutely know they need to take that medication, they decide not to, can't be my fault that he's not doing very well. Then you need to really rethink how that relationship and how that partnership is working. And it's a collaborative partnership where both are contributing to meeting those goals. It's no longer, well, it's the provider's fault, or the provider saying, well, it's the patient's fault, they never showed up. We have to figure out how to get around that. Transparency and real-time information is an absolute critical condition for success. I've often said, you know, it's easier to get into the Swiss bank vault than it is to get my mother's medication record, even today. You know, you have to write the letter, you pay the $40, you download, I mean, it's crazy. But if we expect people to make informed decisions about how to become healthier or manage their chronic illnesses or therapies, then how do we do that if you don't have the information in front of you? So remember the mom who's working and they've got kids at home, they've got the aging parent, and one of them got in emerge with you or in the clinical setting. I don't know about you, but I don't remember when anybody in our family had a vaccination or the last time they took those meds, or is the renewal coming up? Like, it's impossible. So I think we have to build these tools into the fabric of people's day-to-day lives so that they're intuitive and easy, just like checking your smartphone 127 times a day. Here's the last thing that I think we should be thinking about, and that is we talk a lot about measuring patient satisfaction. I love this one. So health providers actually, forgive me, sorry, Krista, I think we're somewhat delusional to think that we need to measure patient satisfaction. We're on Twitter. We are on rateyourmd.com. Professors are on rateyourprofessor.com even. I won't tell you some of the funny stories in our house with a plastic surgeon and who writes into rateyourmd.com, like the husbands of the, you know, the enhancement surgery saying how great it is. And my son, the engineer, says, Dad, you're on Twitter. We need to get our heads around what are we measuring? And what are we measuring what actually the public and patients actually value? A lot of hospitals now are starting to follow Twitter. Why? Because when patients and families are in a hospital, in an emergency room, in a hospital bed, things aren't going so well, they go on Twitter. So a colleague of mine shared the story when she was with her 30-year-old sister in a hospital after having a baby. She got into cardiac problems. There was no cardiologist on call. She went on Twitter. CEO showed up in her sister's room about 2 hours later, and magically a cardiologist appeared. So we need to be thinking about putting the population and consumers in charge of what's valuable. And are we meeting the value proposition? Because really they are anyway. And TripAdvisor, it doesn't matter where I go, hotel, plane, I'll get off the plane, get out of the hotel, I'll get an automatic email on my phone. How did we do today? Can you imagine doing that after a health visit? How did we do today? Probably fall over and stop breathing. But why don't we do that? I don't know why we don't. It's so much a part of our fabric of our lives. I think we should be thinking about it. And then there's the issue of, well, what would we measure? Consumers, if you notice on all these apps, they measure their progress towards their goals. What do we measure in healthcare? Did you live, die, get infected, get readmitted, or have something bad happen? So I don't think we're actually connecting to our consumers even in terms of what we should be measuring in terms of their experience. Again, I think I've talked about transparency and needing to know things in real time, just like we do everywhere else in our life. And here for health system leaders and administrators, we have long focused on the IHI triple aim. How much money are we spending to get the best experience for our patients and having and achieving population health goals? I would venture to guess we need to be thinking about the consumer triple aim. What do consumers look for? The retail industry figured this out a long time ago. Convenience, think about access to care. Cost, how much out of cost money are we actually spending? And in Canada, it's 40% of our spend in healthcare. And do we have a choice? So in our satisfaction surveys in hospitals, at least in Ontario, we ask, would you recommend this hospital to your family, friend, and neighbors? And my answer is, do I have a choice? Because there's only one hospital in this whole community for a 2-hour drive. So maybe we're missing the boat on whether we're asking the right questions. Just a quick quote I always like from Henry Ford. You know, when you go to health systems and you talk about innovation and how we need to transform care, and I apologize, shared this earlier in a meeting. If I'd asked people what they wanted, according to Henry Ford, he said they would have asked for faster horses. In health systems, when we ask what they want, we need more doctors, more nurses, more OR time, more clinics, more hospitals, more everything. Guess what? There isn't more. Maybe we just need different. And we need different in terms of how we're connecting to the populations we serve. We spend a lot of time in the research we do, and I think a lot of Canadian researchers, we spend time on demonstrating proof of concept, new ways to achieve things. I think we need to move that agenda towards proof of relevance. Where else are some of these models and innovations relevant to what sectors in our population? And what's the proof of value in terms of who would pay for it, reimburse for it, and what actually the value proposition it would achieve? So let me just close by saying the future's healthcare systems need to be much more personalized, embedded in people's daily lives, very consumer-driven, self-management and self-regulation actually needs to be much more greater focus, not prescribing as much, collaborative, integrative team, and much more on outcomes driven. Lots of people say, Anne, you're not talking about health innovation, you're talking about a revolution. Probably I am. But I like this quote, nobody's going to fix healthcare for us. I always hear people say, well, the government should do this. Or, you know, those doctors should figure out a better way to do that. It's going to take all of us. It's going to take private sector because they think differently than we do. It's going to take our best clinical teams and provider teams because they have to live with the innovation that we create. It needs the policymaker. We could be the most innovative group in the planet, come up with absolutely a solution. If a policymaker can't make that work from the policy environment, it'll go nowhere. And we need the academic community to measure impact because I'm not sure we're measuring the right thing. When we start working together, we leverage these technologies and our community capacities to support people, then we just might be able to fix it ourselves. And with that, I would be absolutely happy to entertain any questions or any thoughts, anything you think I didn't get right, because that's the only way you can learn. So thank you so much for spending some time with me.